Good evening, everyone. I'm Jim Barba, the President and CEO of Albany Medical Center, and I welcome all of you to the 2014 Heart Association Heart Ball. American Heart Association, both here in the region and throughout the nation, does very, very important work in battling heart disease in all of its complications. And the resources raised by this Heart Ball year in and year out are critically important in order for the Heart Association to do that work.
Albany Med is the region's answer when it comes to heart care because of the depth of our programs. We offer programs for prevention, diagnosis, and treatment of heart disease and stroke that span from simple strategies around lifestyle innovation to the most advanced, high-tech, cutting-edge modalities that exist.
I was attracted to Albany Medical Center because I wanted to be at a facility where I knew that I had all the tools I needed to offer my patients whatever care I felt would benefit them. It was nice to have an opportunity to work with colleagues who I felt were on the leading edge of technology and were willing to change with innovations as they change.
I was at work and started having chest pain and heart palpitations. I was seen in the ER and admitted, and they determined that my mitral valve prolapse had worsened and I was actually going into a little bit of heart failure. That being said, I was very scared until I met Dr. Akujo. She made me feel at ease that she was going to take care of my problem and she was going to make me better again. She made good on that promise. She's my hero.
Research is a very, very important and expensive undertaking. It doesn't happen without significant dollars. And the dollars that Albany Medical Center's research effort gets from the American Heart Association are critical dollars. I will tell you frankly that without that kind of support from the American Heart Association, much of the research that we do at the medical center would not be happening.
Heart care in our region has come very far over the past few years and the changes are truly amazing. Several new technologies have been introduced that help us operate on patients that we could not operate on once upon a time and help the recovery process after surgery be less morbid and be shorter. We have developed a new technique called transcatheter aortic valve replacement, which gives us the opportunity to operate on patients who are once too high risk for aortic valve surgery.
Albany Med and the American Heart Association partner because they are organizations with a common purpose, and that is to develop and implement new and effective means for diagnosing, preventing, and treating heart disease and stroke. That's what we do, and that's what the Heart Association does as well.
There's not a family in America that has not been touched by heart disease. Not one. Certainly mine has been, significantly. Every dollar that anyone here gives tonight will go directly into the type of research that I've been speaking about, and also into the care of patients with heart disease. It could be your neighbor, it could be your friend, or it could be your family member. But sooner or later, those dollars are going to be used to treat someone whom you know and who is very dear to you.